Hello, I'm going to be doing my video over some information for intubation. So I'm going to cover I call them the four cants of intubation, just kind of markers for reasons you would need to intubate. So they are that the patient cannot protect their airway, so for whatever reason they're not able to keep their airway open. That would be one criteria. They cannot ventilate. So the patient's basically not able to breathe for whatever reason. They cannot oxygenate, so maybe they're breathing but the oxygen's not getting to where it's supposed to go, and you can't predict how that airway is going to go. So if in a case of someone, for instance, having a massive stroke and you can tell the stroke deficits are going on and you don't know if they're going to be able to continue to protect their airway or not, and you can't see how that's going to go as the stroke progresses, that would be another reason for intubating. There's also the Heaven criteria. That is something that you need to consider whenever you are getting ready to perform an intubation. So the first one is hypoxia. So is the patient currently hypoxic? And if they are, you may want to consider pre-oxygenating before you start that intubation process. Try to get them up as high as you can in the oxygen saturation before you paralyze them and sedate them and kind of put them down to get that tube in. Do they have an extreme in size? Are they very big or very small? Do you have the right size tube ready to intubate that patient with? And does it match kind of where they fall on the spectrum? Their anatomy is the next one. So do they have any congenital defects going on? Or do they have any trauma to the face or neck area that could prevent you from being able to intubate? Do they have vomit or fluids in the oral cavity? So if that's the case, you'd need to do something like the salad technique to kind of keep those fluids from becoming an aspiration risk as you intubate them. Do they have any exsanguination? Have they lost a lot of blood? Is there a lot of blood in the oral pharynx? And then the last one to consider is the neck. Was there any trauma to the neck? Or looking at it, do you have any C-spine precautions that you need to follow while intubating? Or does the neck also look like it's going to be suitable for intubation? And that kind of leads into the 3-3-2 criteria. So basically what that is can you fit 3 fingers in the patient's mouth? Can you fit 3 fingers from their chin to their neck and then have 2 fingers down to the cartilage? If they meet all of these criteria, then theoretically it should be an easier intubation than if they weren't able to meet that criteria.